Did you know your health is your greatest asset and the key to lasting success? Welcome to Tiger Health Assessment's Optimal Health Weekly Show, where we help driven professionals, CEOs, and entrepreneurs like you take control of your health and unlock peak performance. Hosted by the founder of Tiger Health Assessment, Steve Adams, this podcast is your guide to optimal health through the power of functional medicine and preventative concierge care. Each week, we'll bring you a dynamic mix of expert interviews and solo episodes with actionable insights tailored to your busy, high-achieving lifestyle. Together, we'll explore strategies to enhance your health, optimize your performance, and redefine what success looks like. Subscribe now, and together we'll enhance your health, optimize your performance, and redefine success.
Hi, this is Steve Adams, and welcome to the Future of Personalized Medicine Summit, a one-of-a-kind 3-day virtual event designed for high-achieving professionals, CEOs, entrepreneurs, lawyers, and doctors who are ready to take control of their health and performance through cutting-edge, personalized, and proactive healthcare solutions. In our conversations, we dive into the expertise and uncover practical, science-based strategies that busy professionals can use to optimize their energy, mental clarity, and longevity. We're going to explore real-world applications, the latest innovations, and actionable steps to help everyone in our audience prioritize their well-being without sacrificing their personal success. So I want to welcome you this morning to Amy Spahic and Dr. Sam Fillingane, and they have an innovative technology that we're going to go over today. And I guess first thing is I just want to welcome both of you really quick, and then I'm going to read your bio. How does that go? Welcome, Amy and Dr. Sam.
Thank you, Steve.
Amy Spahic is the founder and chief clinical officer and managing director of Cardiovision Care. Before joining this company, Amy spent 8 years in the cardiac nursing field and 6 years as a cardiac clinical research coordinator for multiple clinics in Illinois, Indiana, and Florida. Dr. Sam Fillingane is a DO and is the company's chief medical officer and co-founder of the company. Dr. Fillingane has spent over 20 years specializing in reversing heart disease for extremely high-risk patients. It's long been a goal of Dr. Fillingane to see cardiovascular risk decline nationally as cardiovascular disease continues to be the leading cause of death and declining quality of life for so many good people all over the world. Welcome, guys. I'm really thankful to have you at the summit.
Thank you. I'm glad to be here, Steve.
You bet. So talk to me real quick. How did you guys come together? Give us a little bit of the backstory there.
Well, 28 years ago, I started doing cardiovascular risk reduction work, and amazingly enough, we started seeing plaque go in reversal. And that caught me by surprise because I was taking a new pathway based on some research, and I then began teaching all over the nation cardiovascular risk reduction principles. I got to meet the physician who developed a product called a multifunctional cardiogram, and Amy had met with the same person, and he put the two of us together at some point, and we have since been like peanut butter and jelly in this business of lives.
I'm going to come back to your comment there, Dr. Fillingane. Amy, do you want to also kind of share how your backstory here?
Yeah, with Dr. Sam. So we've been together for, I think it's almost 10 years. And Dr. Sam has been a big help with reversing a lot of the cardiovascular disease for many, many clients. He's someone that, really needs to get in there and reverse this disease. So a little background on me, as you know, I'm a cardiac research nurse. And what got me into doing the MCG and the heart scan is a long time ago, my father, passed away from heart disease. This machine could have saved his life, found out what was going on with him. And not only that, but it's saving mine. I have small vessel disease, which, still, physicians frown upon, but this is the only device that actually can catch this disease. And now I'm in reversal, mitochondrial dysfunction. It has gone, and thanks to Dr. Sam Fillingane's help, I'm back in reversal.
Mm. And when we say reversal, we're talking about the plaque actually being removed over time, right, Dr. Fillingane?
Correct. You could
Yeah.
have 95% blocked arteries and one day have 0% blocked arteries.
Yeah, and that's the thing I want to really draw out in this interview is that that is possible. We talk about that at Tiger Medical with our two doctors who follow protocols that help people reduce that type of plaque, and people don't want to believe it. And talk about Dr. Fillingane. You know, you were the pioneer in this. I think you said when we met earlier, 26, 28 years ago. What are the fundamental drivers of that have to happen for someone to experience plaque reversal?
Well, the condition is caused by inflammation. So what has to take place is inflammation has to be removed. And of course, if inflammation is getting into your blood vessels to create the atmosphere properly for plaque, and you remove it, then you are going to be very successful because your body actually has a mechanism that will reverse it if you set the stage proper. The problem is that you got to know where the inflammation comes from and one by one turn the tap off.
Yep.
There's 11 disease states that create cardiovascular inflammation, and basically with each patient we find out which of the 11 disease states they have. And it's not good enough to just know what disease state you have, but you have to know how to reverse that inflammation. Where does the inflammation come from in disease? So once you can do both, plaque reversal is quite possible. And so I find it very important that we get this information out. And this device is helping us see things so much quicker than we saw it before. And obviously, it's a whole lot easier to fix a problem with small amount of blockage than it is to fix one with 95% blockage. And I think one of the things that a lot of patients don't realize is it's not a 95% blocked artery that causes most of the heart attacks. It's a 30 to 50% blocked artery that ruptures. And those patients have no symptoms whatsoever before they have the heart attack. So for 66% of patients who have heart attacks, they'll have absolutely no warning. And this device is one of their only tools of help. Why would you seek help for a problem you didn't know exist? Because you had no symptoms. But this device here is something that you would use in the confines of a clinic, and it would be done yearly on a person because it's not expensive and it's not invasive and it's very safe. And there's no reason not to do this test yearly, and it gives you a score, a cardiovascular score. So once a year, you go get your regular physical exam and you get a number between 0 and 22, but anything over 4 is considered significant. So if I had a score of 1.2 the first year, and a year later I went and had a 2.2, and then the next year I had a 3.2, obviously my cardiovascular disease is getting worse. Whatever I'm doing is not working, and I've got to bear down and do better. And what I don't want to do is let myself get over 4. And so, but this machine goes past that. I don't want to take up all the time here. Amy can talk too, but it sees so many different things. One I'm most excited about is small vessel disease and mitochondrial dysfunction, because those are two things that are going to play a huge impact. But now 5 million people in America have heart failure, and this actually sees heart failure 6 to 8 years before it occurs. So if you had 6 to 8 years warning, you might not ever get heart failure. And so if I was a heart failure patient today, I'd be disappointed knowing that I could have known this 6 to 8 years ago, but let's try to catch the ones that hadn't got there already. And it's quite common for people that have insulin resistance and other inflammatory disorders to not only have plaque in their arteries, but they simultaneously, the same inflammation is what stiffens the heart.
Yeah. Amy, you want to jump in on a little bit?
Yeah, he did a great job. You know, I know it's 45% of women do have small vessel disease, and, you know, about 15% of men. So it's not just in women, it's in both. And, you know, we can catch it early and reverse it and hopefully help a lot of people and save lives.
Yeah, and it's also African-American community has a higher percentage of male and female with small vessel disease, is my understanding. Is that correct?
Well, this is pretty true across the board, to be honest, but yes, they seem to have their fair share of all large and small vessel disease. But that being said, some people don't know how small vessel disease works because it works entirely different than large vessel disease. You get small vessel disease off of the little arteries that come off the bigger. There's 4 big arteries around the heart, and there's little ones that come off it that go straight into the muscle. when you start clogging up all those arteries, over time, the clogging gets so severe, you develop this incredible fatigue. Fatigue is so severe, you can't function, you can't work, you can't carry on in almost any aspect of life. And so you end up in medical help. Ultimately, you get a heart cath, and the doctor sees nothing because large vessel disease is all you can see on a heart cath. So the doctor's of the opinion you're doing okay when you're really not. And then 6 months later, this same patient will go from no large vessel disease to 100% occlusion of the large vessels. So they convert quickly. So usually
Wow.
6 months of the heart cath, the patient has a heart attack, and it's 100% occlusion of either 1, 2, or 3 vessels. And so one of the reasons female heart disease has not been something that we can catch is because you got to catch it in that window if you don't have a machine that can see the small vessel disease. But now this device is an electrocardiogram that uses artificial intelligence, and it sees small vessel disease very early, and then it sees it as it worsens, and it gives us a score. So when we're treating the small vessel disease, we can tell if the treatment's working. If the treatment's working, the score goes down. And eventually, if I've correctly fixed your small vessel disease, those numbers go down to 0. And that's a good feeling to go to bed at night having zeros. Now,
Yeah.
I have pretty much all zeros on my scores, and that's because I've been doing this a long time and taking care of cardiovascular disease. If you know how this works, you get tested and you address it. Occasionally, I've had a little score. When I had COVID a while back, I had a few points. I addressed the issues tagged in with the COVID and went back to zeros. And so, long story.
Yeah, that's something I want to follow up on. Have you seen a negative impact from the COVID? And I'm not for or against vaccines on this summit, but have you seen negative effects on people's cardiovascular health from repeated use of the COVID vaccine?
Yes, but now we've also seen it from the infection. And, we went through a terrible pandemic, and it was anybody's guess what was the best. So we don't see much of it anymore. For the people that had vaccine injuries, most of them have been treated. Hopefully they've gotten to people that understand how it works, and their scores go back down to 0 or wherever they were.
Yeah, because I had 4 shots, and in full disclosure for everybody, I did this test with Amy and Dr. Fillingane, and it was tremendously informative. You guys mind if I share my story a little bit?
Sure.
Because it really makes the point. And so I come from a family where a lot of cancer and a lot of heart attacks. And so that was part of my journey and why I started Tiger Medical. I wanted to have a proactive medicine company to address lifestyle and root cause medicine. And so I did everything I thought I could do. I did the, advanced lipid marker panel. And for the most part, that's really good for me. We did a calcium score, and I had a 0. And then I did a Clearly scan, and the person said I had 0 blockage in my large arteries. And then I'm involved in another company that actually measures your microvascular health. And I had a low score there. And Dr. Vink on our team said, it's the canary in coal mine, Steve. You got something. You need to go digging deeper and look for that. So I came and I got tested by Amy, and I in fact have, small, what do you call it?
Coronary.
Yeah, right. And so it literally, for me, I was cruising along thinking I'm just fine, and I'm not. And there's so many stories like that. And I'm so thankful for what you guys have brought to the world. But there was something else that came out of that I think I want to explore now next, and that is mitochondrial health. Can one of you, first of all, describe what is mitochondria, what's its function, and why is it important?
Mitochondria is an organelle within the cell, and its primary function is to produce energy that allows the cell to run. It's your battery power within the cell, and when your cells have adequate energy, they function at maximum capacity and they do well. But we've known for a long time that there's a large subset of patients as they age and as they develop disease states, especially inflammatory disease states, their mitochondria become overwhelmed and they no longer have the adequate amount of energy to function at a normal pace. And what happens then is these cells become concerned. Imagine being a cell within a body where all the cells in the body only have 70% of the energy they need. And you realize you were at 80% a month ago. And so you're declining. And you see yourself going down to 60 and 50, and you're worried about survival. Now, those cells, when they worry about survival, they start to mutate. And as they mutate, they go from what usual ATP is made from through oxidative phosphorylation, and they're mutating to a form of cell called fermentation. And fermentation is cancer. And so there are literally millions of people in the United States running around with mitochondrial dysfunction that don't know it. Now, when your cells mutate, they rarely make it to the other side to become tumors. More time than not, the cells do not survive, and cells behind them come and try to do the same thing. But then your immune system recognizes them as abnormal, which triggers the mechanism for autoimmune. So here you have a problem within a cell that creates the inflammatory issues that relate to cardiovascular disease. It creates the cell mutation that triggers autoimmune illness, and it prompts the cell to change the way it makes energy to eventually become a tumor, and cancer comes from that. So it's a serious problem. And until I had access to a multifunctional cardiogram, or we abbreviated MCG, I had never known how many people had mitochondrial dysfunction. There is no procedure that you can do in an office that tells a person they have mitochondrial dysfunction. There are a few blood tests you can do that would give you the presumption you might have mitochondrial dysfunction. But this test not only tells you have it, it gives you a score. Wow. And if you're treating the mitochondrial dysfunction, the score goes down if the treatment's working. Obviously, the score gets worse if it's not working. And so you definitely do not want to allow a person to stay with mitochondrial dysfunction. I've seen patients through the years that had one tumor right after another. They would get one, they would get over it, and they would get a second tumor, then they'd get over the third one. And these are patients with mitochondrial dysfunction, and had we known that historically, I think we would have done things to reduce the inflammation. And then as you reduce the inflammation, you take the burden away from the immune system, and then the cell is able to make enough energy to do the work. It's the immune system burden that creates the problem for ATP. And so inflammation has always been that thing, and it tags in with the immune system. And so this is the first test that we have that's office-based that can pick up mitochondrial dysfunction. Historically, the way we pick it up is in a research lab.
And so someone's going to look and see if they got cardio problems, and they also can learn if they have mitochondrial problems, which relate to cancer as well.
And autoimmune.
And autoimmune, yeah. And I'm wondering now, we see a fair amount of autoimmune in our 50+ patients in our company. And would you say that mitochondrial dysfunction is the core root cause of autoimmune?
It is a core. It is a root.
A core. Okay, got it.
I don't think it's the only pathway, but it is a pathway of significance. I have this concern issue myself. This is what came out of the testing. So I did a bunch of research and found that one of the ways to support mitochondrial health is a host of about 6, 7, 8 habits. But it's beyond that. How do you? I don't want to answer the question. I know what the answer is, but I want you guys to answer it. There's some help in people's genetics. Like you can get a genetic test, and that can lead you down this path where you go looking for mitochondrial dysfunction. Do you guys want to unpack that a little bit for me? Well, one of the 11 disease states that triggers inflammation is genetic in nature. So the biggest one is the MTHFR genetic mutation, which is in 50 to 60% of the American population. So over 1 out of 2 people have this disorder. And as they get 25 years of age, it becomes a problem. And by the time they're 50, it's a big problem because there's 4 chemicals in their brain they can't make. And that creates problems with brain function, which leads to inflammation because of the way the brain compensates. And it also prevents them from making nitric oxide. And it's basically a genetic mutation that stops you breaking folic acid down to the 5th product called methylfolate. And acid doesn't do anything in the body. It's the methylfolate that does it. And so many people have this and don't know it. And it's not commonly known in all medical circles. I read an article of the day that said 49% of psychiatrists know about it, but less than 5% of primary care physicians are aware of the NTHFR genetic mutation. So it still hasn't circled the medical arena yet, but long story short, it's very big and it causes a lot of cardiovascular and it triggers mitochondrial dysfunction. It's one of the 11.
Yep. Well, it's what I think the lesson here, if you're listening in, is it's important to get tested for your genetics and find out if you have this. And if you do, you're going to have mitochondrial dysfunction as you age. Do people that don't have the variants, do they experience mitochondrial dysfunction just from lifestyle?
Just diabetes alone or prediabetes can trigger it. You can have problems with dyslipidemia. Possibly you drink too much alcohol or eat too much high fructose corn syrup. Maybe you have hypertension that's triggering it. It's sleep disorders, which are quite common today. Chronic kidney disease can trigger it. Mental health issues will trigger it. Autoimmune issues and chronic inflammation. Some people run around with chronic Lyme's disease, or they have some heavy metal toxicity, or they have mold exposure in their house. Any of those things can trigger it. Leaky gut syndrome, which is very common with the aging, and it's even common in young people that have had a lot of antibiotic exposure. And so,
our doctors say it's about 90% come to us with leaky gut.
It's very common. And I think for years, it's hard to go through life without some infection that leads you toward an antimicrobial. And then I think in younger years, when I went through training, we were not taught to, after you give something of that nature, to treat this person's biogenome with care and probiotics and prebiotics to rebuild what you damaged. And so I think you leave the damage. And then as you age, even if you haven't been on a lot of antibiotics, your biogenome degenerates. And so you've got maybe a third less cells than you had to start with. Most people don't realize it, but their biogenome is a 10-to-1 ratio to their cells. So if you have 10 trillion cells in your body, you have 100 trillion cells in your biogenome. So it's a very active network of germs that start into your jejunum and work their way through your colon. There's only 3 layers of your gut. There's a mucosal layer, there's a tight chain layer, and then there's an inflammatory or an immune layer. And that immune layer is where 70% of your immune cells lay in. There would be no reason to put 70% of your immune cells in your gut if your gut didn't leak quite regularly.
So go ahead. I'm sorry, doctor.
Things that cause your tight chains to let go, or when you eat too many sweets, or you eat more carbs than your body will tolerate, or when you drink alcohol with excess, or when you have too much high fructose corn syrup. So there's a lot of reasons to cause the tight chains to let go. That mucus is actually eaten by the germs within your biogenome that when they don't get fed the proper amount of fiber, they will start eating your mucin layer. You can eat foods with emulsifiers in it, and that will basically remove the mucin layer. And then if you remove the mucin layer, eat the wrong amount of sweets or fructose or alcohol, and then there's nothing left but your immune system layer. So leaky gut is actually quite common. And if these gut get into your bloodstream, they will cause problems. And we're finding that bacteria are actually in the brain in various places, and they don't belong crossing into that market. But they do, because basically you've got a sewer transferring through your intestinal tract that is finding holes in your intestinal system. Imagine how much of a stress that puts on your immune system when you've got 50 leaks in your intestine here and there.
What? So somebody finds out they have small vessel disease at some level. They find out they've got mitochondrial dysfunction. You give them a plan that will target it. And what kind of time are they? First of all, can they reverse it? Number one. And I think we know part of the answer because we talked about cardiovascular already. And secondly, what kind of time is involved to reverse it typically?
Well, depends on the shape you're in. you've been shot by a cannon, it makes a bigger hole than if you got shot by a BB gun. But
Yeah.
assuming it's a bad one, it may take weeks or months. But the first job is to repair the leaks, and then you got to restore the germs to adequate health. More times than not, when you've done that, you've stirred up your mast cells in your gut, so you might have some reflux, some constipation, some diarrhea, or all the above. And so after you go through the leaky gut regimen, you have to take care of a mast cell activation syndrome activity too. And when you put it all in concert, you start eating foods that you had stopped tolerating, and you start tolerating them again. And so some of the things that you thought you were intolerant of, you actually could do okay with. But you have to feed these germs. And we used to put probiotics down without prebiotics. And so
Right.
you were putting germs down in a hostile environment, but not feeding them well enough that they couldn't sustain life. So it was kind of like pouring something into the abyss and nothing came back. But
Yeah.
we learned about the prebiotics and even some postbiotic regimens. It created some stability for these germ matrices. And the biogenomes that you see in Florida versus what you see in New York versus what you see in California or Mississippi, they're all different. And so
Yeah.
it is a complicated set of details. And so how I treat you in your state versus other, it could vary because of what is actually going on in the two different areas.
Sure. Then you get a weird guy like me who's been in 45 countries in the last 20 years, and I probably have some unique stuff.
Probably
Probably.
So, yeah, I'm on my third mucosa and biome regimen with just because we keep after it. But I know that's great. So, but somebody, if they make a real commitment and they follow what you're saying, in a year they can really transform their health. Wouldn't you say is a fair statement? Typically.
Night and day difference. People with leaky gut, for instance, they have a slowing of their brain. They tend to not think as clearly as they used to, and their
Yeah.
energy's reduced, and they think that maybe it's just old age, and it's not. It's leaky gut that is basically playing havoc with their nerves. Now, the fear factor is as you play havoc with your nerves and your brain too much with this, you can cause some nerve retraction, and that is the beginning of how you develop Alzheimer's or form of dementia with aging. But you can correct that just by fixing the leaky gut, and then memory comes back and energy gets better, and life goes back. So all these people that think they're getting older just because that's just what happens, they need to rethink that. You fix
Right.
it wrong, and you'll be amazed at how well they can do.
Yeah,
Yeah.
including with lifestyle optimization.
Amy, go ahead. You want to keep going?
Yeah, a little lifestyle changes. We're so used to a habit, and it's bad habits that we have. So if we can reprogram our brain onto eating healthy and trying, the less the carbs is better for patients who do have a MTHFR condition and, insulin resistance. We have to watch our carbs. And Dr. Sam has a great program on low carb, less than 25 grams carbs every 4 hours.
Mhm.
And if we just retrain ourselves to be healthy, we can reverse this disease faster.
Right. Well, and so I guess I would encourage people get tested genetically so you know what you're dealing with. And then especially people as they're starting to reach middle age, it really is important that you take a look at your health from a different perspective than the standard annual physical. I'm not disparaging anybody in traditional medicine, but there's limitations to that method, and especially in terms of preventative. And seek out a functional medicine type physician who's going to look at things from a root cause. That's everything we do at Tiger. We've done that for 5 years. And then if you work with us, you're going to visit with Amy and Dr. Sam, because that's just standard protocol now for all patients that go through Tiger. But also, how can they find you guys directly? Like if they've already done some of that stuff and they just want to find out, they want to have that consult with Dr. Sam like I had that was so terrific. How do they find you guys?
Yeah, they can go on the website, cardiovisioncare.com. There's a little link at the bottom of the page where they can click on info at cardiovisioncare.com and just send a quick message that they want to schedule an appointment or just want to talk or consult. And we're pretty quick to respond. so they can reach out through that.
And will they typically come to Jacksonville, or are there more places around the country? How does that work?
We're nationwide and international. So depending on, where they're located, we'll find out and we'll set up an appointment where we can come to their home. The machine is mobile, so we can come to the place of business, their home. They can come to the office in Jacksonville, which is 3410 Corey Road, and that's Jacksonville, Florida, 32577. I'm sorry, 32257. And they can come over here and get scanned, or, just meet with me and talk and look at the machine if they want to incorporate into their corporate wellness programs, or, we come and do scan days at clinics. So we have locations in Longwood, Florida, Lakewood, Florida, Clearwater now, Miami, and then we're hoping to get Tennessee and a lot more to come.
Dr. Sam, any last words you want to share?
Find a way to get this test done, because this test is a game changer. And for those of you that think there's nothing wrong with me, remember that 2 people out of 3, 2/3 of people that do have heart disease have no knowledge of it until the heart attack itself. I hope everybody stays healthy.
And there's a high percentage of people who die in their first heart attack. Is that true?
That's correct.
Yeah. So anyway, I'm grateful. It's having a major difference in my life, and I can't recommend it enough. And thank you guys for joining the summit. We're so grateful.
Thank you.
Steve Adams here from Tiger Health Assessment, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Health, you can. Our comprehensive blood screening identifies hidden risk before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Health at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.